Imagine a world where the flow of time literally just stops, or where the faces of the people you love suddenly morph into these grotesque masks. Or what if the running water from your kitchen sink started speaking directly to you? Seriously, how would you even begin to navigate a world where your own senses betray you at every turn?
Consider this chilling account from Daniel Schreiber. He suffered from severe mental illness back in the late 19th century, and he described his condition by saying he never had a single moment except when sleeping where he did not hear voices. They accompanied him everywhere. Before we throw around a bunch of medical terminology and clinical jargon today, we really need to ground our discussion in this raw, deeply terrifying human experience. Because at the end of the day, this is what we're actually talking about. Human beings trapped inside a fractured reality.
Think of sensation as your biological hardware. It's your eye receiving light or your ear receiving sound waves. But perception, that's the software. It's your brain actively taking that raw data and processing it for form, color, motion, and meaning. The eye simply receives light, but the brain actually does the seeing. In neurological conditions known as agnosias, the hardware works perfectly, but the software crashes. The person senses the object, but literally cannot perceive what it is.
To really wrap our heads around this, let's look at the famous case of a man named Virgil, recounted by neurologist Oliver Sacks. Virgil had been blind since infancy, but at 51, he had his sight surgically restored. The hardware was fixed, but his perception software was entirely uncalibrated. When looking at a cat, Virgil could see a paw, a nose, a tail, but he couldn't synthesize them into one cohesive animal. He had the raw visual sensations, sure, but he completely lacked the perception to put the puzzle pieces together.
When perception lies, the raw data of reality.
In psychiatry, we draw a really stark line between sensory distortions and false perceptions. So, a sensory distortion means a real object is physically there in front of you, but you're perceiving it incorrectly. Like maybe the size or the shape or the color is just off. A false perception, though, sometimes called a sensory deception, means a completely new perception is happening without any external stimulus whatsoever. You are literally seeing, hearing, or feeling something that simply isn't there at all.
Let's look at sensory distortions first.
We call these structural distortions dysmegalopsia. This is where objects might look impossibly small, micropsia, often from retinal edema, or massive, macropsia, from retinal scarring or accommodation issues. You can also get irregular shapes, which is metamorphopsia. But perhaps the most terrifying clinical reality here is paraprosopia. Imagine sitting across from a friend, and right before your eyes, their face dynamically morphs, becoming lopsided and undeniably sinister. The emotional toll of watching someone you love distort into a monster is just incredibly profound.
When we get into how the brain handles distance, leading psychiatric texts actually diverge a bit, which is super interesting. The author Sims classifies distance distortions as teleopsia, where objects appear impossibly far away, and palopsia, where they loom incredibly near. On the flip side, Fish's text highlights paroxia, a highly specific visual experience where an object appears to retreat endlessly into the distance without actually changing its perceived size. We also see allosthesia, where an object is perceived in a completely different position than expected, which is often seen in right vascular putamen lesions.
And then you have Akinetopsia, an incredibly rare glitch following bilateral posterior cortical damage, where the brain just stops perceiving motion altogether. Imagine trying to pour a cup of tea. Instead of seeing a flowing stream of liquid, the patient sees a static, frozen block connecting the teapot to the cup. It literally looks frozen, like a glacier. They can't stop pouring at the right time because the visual updates of motion simply aren't rendering in their mind.
Well, your brain can actually crank the volume knob of reality all the way up or completely dial it down. Hyperesthesia is an increased intensity of sensation. For example, in states of severe anxiety, someone might suffer from hyperacusis, where an everyday sound like a door closing sounds like a terrifying clap of thunder. We also see things like palinacusis, where a sound abnormally persists or recurs. Conversely, hypoesthesia is a decreased intensity, like hypoacusis. In severe depression or delirium, the world can feel incredibly muffled, gray, and distant. But this reality filter doesn't just mess with the volume. It can literally repaint your world. These are qualitative changes. Some conditions tint a patient's entire vision yellow, called xanthopsia, red with erythropsia, or even green, known as chloropsia. A lesion in the occipital lobe can cause achromatopsia, a total absence of color. Meanwhile, things like digitalis poisoning can cause dyschromatopsia, entirely perverting how colors are perceived.
We also see derealization in this category, where the whole environment just feels unreal, or even true changes in gustation, like the distinct metallic taste some people get when taking lithium.
Now let's talk about the real glitches in the matrix. Take palinopsia, for instance. You might see a black cat on the corner, and then repeatedly see that exact same cat appearing out of nowhere for days. In palinoptia, a tactile sensation outlasts the stimulus. You could put down your toothbrush, walk into the next room, and still vividly feel those hard plastic bristles gripped in your empty hand. Or exosemesthesia, where you feel a touch on your arm but experience the sensation as if it's happening to the table next to you. And then there are trailing phenomena, often seen with hallucinogenic drugs, where moving objects look like a series of discontinuous frozen images trailing behind the object. A particularly wild glitch is the splitting of perception. Usually, our brain effortlessly binds our senses together. You see lips move, you hear a voice, it's one unified event. But in this state, a patient might watch a television and feel like the image on the screen and the audio from the speakers are entirely unrelated, competing entities. They're left stranded in this fragmented world where the glue holding reality together has just dissolved.
Distortions of time, breaking the clock.
Now, clinical psychopathology splits time into two very distinct categories. First, you have objective time. This is the verifiable loss of clock time, like losing chronology due to diencephalic or frontal lobe lesions. A patient might remember autobiographical facts, but they completely lose the ability to appreciate their timing or duration. Then you have subjective time. This is how time actually feels. To a depressed patient, 30 seconds can painfully stretch out. In mania, time speeds up, or they might experience the Zeitstruffer phenomenon, where time flows at a dizzying, altered pace. To really grasp how heavy this can be, let's look at age disorientation. This isn't just, forgetting your birthday. In chronic schizophrenia or Korsakoff syndrome, a patient might have a discrepancy of 5, 10, or even 20 years between their actual age and the age they believe they are. They become culturally frozen in the period right before their illness began. For them, time is literally standing still, anchoring them to a past reality while the rest of the world marches on.
Illusions and hallucinations, complete fabrications.
First, let's pin down what an illusion actually is. In an illusion, the hardware is working perfectly, and there is a real, physical stimulus in the environment, but the software misinterprets it. Think of walking down a dark street and briefly perceiving a swaying tree branch as a threatening attacker. The branch is real. The monster is just your brain's hypervigilant misinterpretation of that raw data. Imagine if you misread a faded sign outside a garage, just because your brain expected a certain word to be there. That's a pretty mundane completion illusion. But contrast that with the pure horror of an affect illusion, where someone is in a state of intense terror and they misinterpret a curtain moving in the breeze as a literal attacker coming for them. And periodolic illusions, that's when you see highly vivid faces in the clouds or staring back at you from a fire, completely driven by an overactive visual imagination.
Now, understanding a true hallucination requires a massive amount of empathy from us. A hallucination happens completely without an external stimulus. There is no tree branch, yet it's experienced in external reality. For the patient, a hallucination of a voice or a figure is as real, as three-dimensional, and as concrete as you or me. It's not just a trick of the imagination. Their brain is actively rendering a fabrication right into the objective physical space around them.
When someone goes through an acute organic mental state called delirium tremens, which is often tied to severe alcohol withdrawal, the visual phenomena they experience aren't just static images. Patients describe rapidly changing, absolutely terrifying visual hallucinations that shift so fast they can barely even put them into words. It's a profound level of chaos, really showing the sheer horror of a brain misfiring on all cylinders.
But we often just think of hallucinations as visual or auditory, right? Well, the crucial thing to understand is that hallucinations can completely hijack your physical sense of touch and your bodily autonomy. Patients report thermic hallucinations, like feeling their feet are literally on fire, or haptic ones, like being touched by a dead hand. There are even hydric ones, which is the sensation of water sloshing around inside your chest. Visceral hallucinations go even deeper, making a patient truly believe and physically feel intensely bizarre sensations deep within their inner organs.
We have to contrast this sharply with pseudo-hallucinations. Now, these are also involuntary, super vivid mental images, but they lack the physical substantiality of a true hallucination. And crucially, the patient locates them in their inner subjective space. They feel it happening inside their head or in their mind's eye, rather than projected out into the physical room with them.
Which leaves us with one pretty massive question.
If a miscalibrated filter in your mind can freeze flowing water, detach sound from sight, and paint monsters into thin air, we have to ask, how much of your everyday reality is a hard, objective truth, and how much is just a fragile, subjective construction quietly maintained by the software of your brain?
Keep asking questions and keep learning.
Check out our channel for more videos and subscribe.